back to the big focus. Now, we've been covering COVID-19 consistently. It's the biggest story of the day, the year, and our lifetime. Everyone is grappling with someone they know who's suffering from COVID-19, a family member, a friend, a relative, a friend of a friend who needs help, whether it's getting a bed, oxygen, medicines, plasma. So just before we begin the show, an appeal to everyone to do as much as you can. This is the time to come together to save lives and make sure we get through this. But in the midst of this, let's just give you the latest of what has been happening. 2.17 new daily cases is the latest figure we have. So that means over 2 lakh cases have been registered in India in the last 24 hours. This is the second day in the row that we've crossed the 2 lakh figure. 1,185 COVID deaths have also been clocked. 10 states now account for 80% of new cases, and this is an important statistic because for the longest time Kerala and Maharashtra together accounted for about 70% of the cases. Now it's 10 states that account for 80% of the cases, which shows you how widespread the infections are getting. Weekend curfews are being announced. Now at least 16 states will go into this weekend with some kind of restriction or the other, and meanwhile the queues are getting longer for beds and for other facilities as well. We want to focus though today on what is happening with children and COVID. This is an area that has not been discussed very much. It's a bit of a grey area because there's not much official data on it, at least from the Health Ministry and the Government of India. When figures are put out, they're not put out specifically age-wise, and it's not known how many children are being affected. Why it's important is because so far the general impression has been that the young, the kids, are less expected to get COVID-19. If they do, they're usually carriers, asymptomatic carriers, nothing much happens to them. But anecdotally, we're hearing of more and more children getting infected and in a more severe degree. So what are the numbers like? Let's first go across to Times Network reporter Ayushman, who's joining us with the details based on numbers that he has sourced.
Like we know, most of the cases are being contributed by Maharashtra. So the top cases have come from Maharashtra, where earlier in the previous wave, only 50,000 children were infected by COVID. This time the number hovers around 60,000. Now after this is the state of Uttar Pradesh, which has witnessed about 15,000 cases, and currently we have also Chhattisgarh, which has about 16,000 children below the age of 17 years who have got infected by the COVID infection. These are the states. Most probably, if you see the data right now, we have Chhattisgarh, Uttar Pradesh, Delhi and Maharashtra, and also Karnataka as the worst affected states. They have come back because the numbers have started to increase in these states. And in these states only, previous year, when the first peak was surging, or rather when we were seeing the peak, rather 97,000 cases, these were the states where this was the scenario of the infection in the below 17 years age group.
All right. Dr. Anupam Sibal, Senior Pediatrician, Apollo Hospitals, with us on the show. Dr. Tushar Maniar, HOD, Pediatric at Nanavati Hospitals on the show. Dr. Vinit Samdani, Breach Candy Hospital on the show. Dr. Balasubramanian, Advisor to ACVIP, the Indian Academy of Pediatrics, also on the show. Welcome to all of you, and thank you so much for speaking with us. Dr. Sibal, let me start by just asking you what you have seen. Would it be correct to say that more children are being impacted by COVID-19 in the second wave?
Hi, thank you very much for having me on your show. Yes, definitely. What we are seeing is, and I speak not just for Delhi, we at Apollo Hospital have 33 pediatric units across the country. So we are definitely seeing more numbers, but of course, we are seeing fewer numbers in certain parts of the country when you compare with, say, Maharashtra. So clearly, we've seen that trend, more cases there, but we are now beginning to see, say, in the last week or so, more numbers in Delhi. So this was not the case in the first wave. What we are also seeing is that when one family member gets infected, in the past we did, like even in a couple, we have the husband or the wife positive and the other partner be negative. But now what we are seeing is that if one person gets it in the family, 2/3, 3/4 of the family gets it too. So this is another trend that we are seeing. The third trend we are seeing is that kids are presenting with slightly varied presentation. So while cough and cold and fever is standard, but we're also seeing kids with diarrhea and tummy ache, which we didn't see in the first wave. And of course, we have to realize that little ones are not going to have symptoms that, they're going to be able to tell us about. So when you're looking at less than one, they might actually have no symptoms or very mild symptoms. But when you test them as part of the family screening, they turn out to be positive. And it's really not possible to mask young kids. So this really opens up another challenge in terms of how do you manage these kids. I'm so glad that the decision for class 10 exams and class 12 exams have been taken, because that really would have been a disaster for us. Managing, groups of people coming together is becoming a serious issue, and anything that can be done to control that, contain that, I think really is essential.
Oh, absolutely. Dr. Samdani, what have your observations been? And a follow-up to that, A, are there more children that are being impacted this time around? And B, is the nature of infection more severe?
Yeah. Thanks, Tamanna. Good evening, everyone. I feel, let me start from March 2020. What happened in March 2020 was the kids were less in number. And I feel the reason being was very simple. There was a lockdown, and the lockdown enforced all schools, playgroups, child activity to be restricted. With that, a lot of offices were also shut, and they were mostly work from home. Now, as time went by, when we entered into January, February, there was no concept of restriction. We got vaccinations kicked in. So people had one dose, they took 2 doses. And with the vaccination also kicked in, there was an Peltzman effect that was coming on to the general population that said that because I'm vaccinated, the chances of me contracting COVID is very less. So therefore, the high-risk behavior increased. Number 3, marriages, restaurants, bars, outings, offices, everything was on. So, and child playgroup, sessions with other kids and parents meeting with the kids, everything started. So therefore, we've seen a rise in COVID cases in kids. But mind you, as Dr. Sibal had said, that according to me, for every one child, there are 2 kids at home who are suffering from COVID, and they are adults in nature. So the kids generally present, most of them, 99% of them present with 1-day fever to 36 hours of fever. It's mild grade, running nose, and in 36 hours, they literally settle down. Now, the question is, the number of cases are yet masked in kids, because the minute we have one of the adults tested positive, generally in 24 to 36 hours, if the kids settle down without fever, we don't test them. So therefore, the numbers that we are seeing in kids is still less. If we would have to test them, there would be much more than that. And there's only 1% of the kid population that are or is getting complicated. But to my understanding, the reason why they're getting complicated is late treatment or late recognition or late addressing to the doctor that the fever is still persisting for 3 days, 4 days, 5 days. So therefore, basically late medical attention, and that's where we are getting complicated.
Dr. Balasubramanian, how do you look at the situation? Because now you have reports of children having to even be hospitalized in some cases. Is this the function of a mutation which is impacting children more than last time? Or is it just because it's more widespread that we're seeing more children being impacted?
First of all, the observations in Mumbai and Delhi are quite different from what we have observed in Chennai. The situation in children is not far different from what it was last year as of now. The number of sick children admitted for COVID-19 in Chennai, at least in our own institution where we have been following up for the last 15 months, nothing dangerous is happening in kids. That's number 1. Number 2, first of all, we must all remember the fundamental fact that 90 to 95% of all pediatric COVID is going to be asymptomatic. If somebody says cases have gone up, it's mainly because we have done more testing and not because the cases have simply gone up. That's number 2. Number 3, most cases of COVID-19, even if they are symptomatic, in pediatrics, they are going to be very, very mild illness by and large. In fact, if you look at literature, I don't think we have Indian data on it. If you look at literature so far, the risk of mortality for a child dying of COVID-19 infection is 0.03%, much lower than for any adult. Lastly, it's not COVID we are worried about. In fact, our institution reported the first case of MIS-CD, multisystem inflammatory syndrome, in children in India. And that was also our first COVID PCR positive case. That is what we are worried about. It is not simple COVID. Most cases are going to get all right with paracetamol and parental counseling. They don't require any admission. They don't require any intervention. But on the other hand, this dangerous disease, which doesn't occur in adults, though there have been reports, is something very similar to what is called Kawasaki disease. These children could get missed at the right time. They may land up in the hospital late in the course of the disease, like Dr. Anupam Sibal said, in shock with cardiac complications. So it is the duty of the pediatric community and the medical community at large and the press also to say that COVID illness might be mild in children. But if for any reason, if a child has got fever for more than 3 days, with or without a rash, without even cough, with diarrhea and abdominal pain simulating appendicitis, tiredness, fast breathing, that could be either severe COVID-19 or MIS-C, and that child needs to be hospitalized. That is one. Lastly, in the midst of this COVID pandemic, there is one thing dangerous that can happen. Fear of going to the hospital might prevent parents from taking a really ill child, not suffering from COVID, but something serious like brain fever, meningitis, or pneumonia. For fear of contracting COVID, they may hesitate to take the child at the right time. It is our duty again to sensitize the public for this.
Okay. That's an important point, that don't let the fear of COVID stop you from giving the right medical treatment to your child as parents. Dr. Maniar, your comments on how widespread this is and how concerned are you as a pediatrician right now? Are you seeing more cases this time around?
Tamanna, thank you very much. We are seeing definitely more number of cases, and I agree with most of the factors which have been mentioned by my three colleagues. I like to divide my children into two broad bands, below 10 years, above 10 years. Because again, below 10 years, I mean, between 1 and 10 years, not going to have much of symptomatic problem. Whereas from 10 and above, they do have high fever for first 2 or 3 days, which we need to manage carefully, again, with simple paracetamol and counseling, and make sure that they don't get into complications. We are seeing more numbers, and I feel one major thing is we are definitely seeing at least 3 times or 4 times the number in adults. So proportionately, are going to see more children. Plus, the testing has become easily available, easier, and patients have become more acceptable to the testing. So that's another reason for seeing the increase in number. And I agree with Dr. Balasubramanian that I am still very optimistic about the acute phase or acute problems of children. But what we are concerned about is what he mentioned about the MISC, which can come immediately or even up to 3 to 4 weeks after a COVID infection. So we are worried that all these children who have got COVID or exposed to COVID in the family should not land up with MISC.
Okay, so just break this down for us, Dr. Maniar. If there is a case of an infection in a family, and now you're seeing with the second round, with the newest strain, that if one member of the family gets infected, more tend to get infected fairly quickly. So if this is such a situation and there are children in the family, what are the important signs to look out for?
So first and foremost is the fever. And if any family member has fever or has tested positive, we would say go ahead and get the children also tested even before the symptom. That will help them getting more serious about isolation and quarantine and easier to monitor them for any complication. This is especially true if you are looking at children in the family who have any comorbidity, as in any other medical illness, which will put them at a higher risk. I would be monitoring high fever above 102 a fast breathing child, if urine passed less than 6 times, a child who is not eating adequately, a child who develops a rash, or more importantly, suppose a child is already having cough or has asthma or wheezing, his pattern of cough has changed. He is either very irritable or has complained of new onset headache. Any of these complaints would be a red flag for me to make sure that the child is attended urgently.
Dr. Sibal, would you want to add to that? You know, people who are watching this with children at home, at parents, what should they watch out for? How should they also protect their children?
I think, I'd echo whatever has been said by my colleagues. But the point that I'd make is slightly, different is that quite often we are asked, you're not going to be giving anything dramatic. Even if my child turns out to be positive, I'm positive. Why should I get my child tested? And, typically the question that I ask is, how many people live in your apartment or in your house? And it's typically grandparents or other people. And I said, you have to protect everyone, because what we are seeing is one member getting infected, multiple members get infected. And if you have a young child and you don't know whether the child is positive or not, anyway, it's very difficult to get a child to wear a mask at age 1, age 2, age 3 or 4. So it's important to know, because you have to protect those that don't have the infection. You very importantly have to protect the grandparents. So I think the first thing is to know, why be in the dark whether the child has an infection or not. Then as Dr. Maniar said, these are the signs that we have to look out for, which I shall not repeat. And the third is, please be in touch with your pediatrician. Make that phone call, use WhatsApp, connect with the pediatrician and go through the danger signs, because we really don't want someone to be in hospital and get really sick. We need to provide appropriate treatment guidance, which we can do on the phone. And of course, as has been talked about, the MISC, which is a condition that bothers us, but fortunately the incidence of that condition is very low. It's been largely reported in the Western population. So I do want to reassure parents, because I don't want them to just go on. And because these days you say something and in half an hour, everybody's Googled it. And then the moms get into a panic saying, hey, listen, yesterday my kid got diagnosed and now you're worried about MISC on ET now. And that's what Tamanna said. So let me please reassure the moms and the dads that it's fine. I mean, it's really more of a Caucasian disease. Yes, we've seen some numbers in India, but just bringing to people's attention that should you have signs like, which with high fever and, redness and a rash and, the child really not looking well, we have to consider MISC, but that's a diagnosis that is made by a specialist. So overall, I think to summarize, yes, we are seeing more kids. Kids can actually be sitting at home and spreading it to other members. We really need to confirm the diagnosis, manage them well in consultation with a pediatrician, not worry too much about what's going to happen, because most of them do very well. And of course, the thing that we are all waiting for as pediatricians is, when will the vaccine come? And hopefully in the next few months, we should have a vaccine. And yes, every kid needs to be vaccinated.
Yeah, I'm going to come to that, that should kids be vaccinated. But before that, Dr. Samdani, I want you to take us through some precautions for parents and for children, because with children it does get difficult. They're cooped up all the time. There's no more meeting friends. Now in some places the restrictions are even more. So what is okay and what is not okay? Is it okay to go down to play? Is it okay to meet other children? Is it okay to engage in some group activities right now? All of that is off the table.
Right. So Tamanna, at this moment, there's one more point that I wanted to add, is that usually when someone's in a nuclear family with kids and if the parents get COVID, they tend to shift their children to the grandparents' house. So please don't do that, because your child may be a silent asymptomatic carrier and you're going to be affecting the senior citizens or the adults to the other house. Number one. Number two, I think the preventions that we need to take is obviously below 2 years, as they correctly said, that there are no masks allowed. And post 2 years, yes, masks should be tried to be enforced if they comply to. But nonetheless, if any of the family members are with COVID-19 at home, they must comply with a mask. And the mask should be there in the house regularly and 24/7. Hand washing techniques, put your arms or elbows while sneezing or coughing, and to wear a mask, and obviously restrict the outdoor activity. Absolutely. At this point today, from today or maybe since the surge. I think at least for the next 45 days until the surge doesn't reduce in kids at least, outdoor activity, play groups, schools, meeting friends should be absolutely a no-no.
You know, it is something which is going to be difficult to explain to children. It's difficult for children who feel powerless at this time as well and cooped up, but it's important. Dr. Balasubramanian, I want your view on the vaccine. The vaccine is beginning to be tested in various parts of the world. In India as well, there are plans to begin testing on vaccines for children. And there is a very real concern whether these are apt for kids, considering these vaccines have not had a very long time of being around and not a lot of data available at all.
As of now, there is no approved vaccine available for vaccinating children below 16 years. Trials are on. In fact, Pfizer has asked for authorization, emergency authorization between 12 to 15 years of age. And other companies are moving ahead, including AstraZeneca, with vaccine trials in children. Even in the history of vaccinations, the history of immunization, this is very strange because this is the only vaccine I have seen, at least during my career, where we are giving adults and not children. It has been the other way in most of the vaccines. And in this disease, the priorities right now are not for children. We are trying to only protect. As I said earlier, the mortality and morbidity is low when compared to adults and those with comorbidities. So vaccination in children is right now not a priority. And there are also concerns whether the vaccines which produce antibodies could result in increase in the incidence of MIS-C. And no data is yet available. So I'm not giving a negative comment on the vaccines for children. But I'm afraid vaccination is the only way we can improve the herd immunity. Because in India, 40% of the population are pediatric and young adults. So unless you vaccinate and improve the herd immunity, I think conquering this viral infection is going to be difficult. That way you look at it, vaccination in children is a sensible thing to do. But after trials are completed, after safety is established. On the other hand, we must also remember there are going to be several other positive benefits of vaccinating children. Look at what has happened in the last 1 year. Most of the children are glued to the gadgets. They have not had physical exercise. They have not had the real stimulation of in-house classes, lectures, educational exercises. They have been psychologically deprived. They have put on weight. A lot of obesity I have come across in practice. I've seen children are coming back after 1 year with a weight gain of 15, 20 kgs. So all this can be prevented if we are able to vaccinate and then open the schools up and open the normal life for children, protect the children. In turn, this will improve the herd immunity, protect the vulnerable population in the community. So vaccination will become a priority very soon, but I don't know when it will come, maybe a year or two.
Yeah. A year or two. Well, there are many reports that as early as July or August vaccines may be available, but of course we have to see what the data is like and what the efficacy and safety, etc. is like. But I think the important takeaway over here is what impact COVID-19 and the restrictions is having on children as well, physically, emotionally, mentally, and on their health too. Thank you so much to all of you for joining us on this discussion today and shedding light on what we should do, how we can protect the kids, and how this is not about panicking at all, but consulting your doctor as soon as you see any worrisome signs. We'll take a very short break, but on the other side, we're talking about worrisome signs for the Indian economy. Will the second wave derail the progress we've been making? Are we already seeing the impact? That discussion after this break.